Do you have advice for people on how to find a way out? You're a man who has suffered in this way, perhaps continue to suffer in this way. How do you find a way out?
The first thing I do as a clinician, if someone comes to me and says they're depressed, is ask myself a question. Well, what does this person mean by that? So I have to find out, because maybe they're not depressed, maybe they're hyper anxious, or maybe they're obsessional. There's various forms of powerful negative emotion. So they need to be differentiated. But then the next question you have to ask is, well, are you depressed? Or do you have a terrible life? Or is it some combination of the two? So if you're depressed, as far as I can tell, you don't have a terrible life. You have friends, you have family, you have an intimate relationship, you have a job or a career. You're about as educated as you should be given your intelligence. Use your time outside of work wisely. You're not beholden to alcohol or other temptations. You're engaged in the community in some fundamental sense, and all that's working. Now, if you have all that and you're feeling really awful, you're either ill or you're depressed. And so then sometimes there's a biochemical route to that, treatment of that. My experience has been as a clinician is if you're depressed, but you have a life and you take an antidepressant, it will probably help you a lot.